Great. Thank you, Kevin. So great to be back with everyone. I know last time I was here, it was just as Secretary Beam was taking on her new position, and we had quite a bit of unknowns at the department, but I'm pleased to be back to give a brief update. So I want to start, I think, by talking about number of cases. Pennsylvania is still continuing to see a relatively high number of cases, although it does seem that we have plateaued. However, plateauing at about 4,000 to 5,000 cases a day is still much higher than we would like to see. So we're really continuing to press on vaccine and vaccine hesitancy, which is something I'll talk about in just a minute. We also are keeping a close look on hospitalizations. That's always something that we're very concerned about at the department because of our strain on the healthcare system that we've seen over the past year, really, with COVID. We are at about 2,600 people hospitalized across the Commonwealth. And that 14-day moving average of number of hospitalizations is about 3,600. So that's lower than our peak at the end of December, but our average is still higher, obviously, than we would really like to see. What everyone really wants to talk most about, it's our hottest topic, of course, is vaccine. Pennsylvania, we're really proud that according to the New York Times vaccine tracker, PA ranks 10th. At 43% of our population with a first dose. The average across the nation is 40%. So we're very happy to be 3 points over average on first dose. The CDC vaccine tracker identifies PA at 5th for total doses administered. So we're really feeling in a much better place than we were several weeks ago, knowing that there are still some access issues, and for vaccine, we are still in a resource constrained environment, but it's getting better and better. Something else I'd like to mention is Johnson & Johnson. As most of you know, the FDA, the CDC, and ACIP have asked that or recommended that providers pause on the administration of the Johnson & Johnson Janssen vaccine. Here at the state, we have also asked our providers to pause on that administration until we learn more from the federal government. It's our understanding that ACIP meets again on Friday, and we're hopeful that they will put out recommendations so we can continue usage of that product, whether it limits the number of people we're able to supply it to, or whether it can allows us to continue to vaccinate everyone with Johnson & Johnson, just with some further education for physicians to be mindful of the blood clotting issues that we've seen. So we're really just waiting along with all of you to see how we can continue using that product. Our Pfizer and Moderna supply has essentially flatlined. So we're receiving about the same amount of vaccine per week with those products. And the department has several weeks ago, we identified a way to help improve our vaccine administration rates. So we really rely on our pool of vaccine providers. And about 3 weeks ago, we decided to target our provider network to about 300 providers. And that's really where we sit right now. So to determine this provider optimization, we took several factors into account, including geographic reach, access, equity, throughput, high demand. We also took a look at the ability for providers to maintain the Secretary's order, which requires administration of 7 or 80% of vaccine within 7 days. And also, of course, the important data requirements that we have at the state, where all vaccine data needs to be reported into our PASYS system within 24 hours. The providers in the targeted network include hospitals, pharmacies, medical practices, federally qualified health centers, and public health providers like our county and municipal health departments. This is a good spot just for me to remind everyone that Philadelphia is its own vaccine jurisdiction with their own with their own plan, their own budget. So they are operating separately from the rest of the Commonwealth. It's not unusual, and it's been that way for quite a long time. Other states with large cities have similar operational setup. New York is a good example of that. So now that we've talked about the number of providers and the way our provider network has been targeted to encourage high throughput, I also wanted to highlight that the federal government is also pushing vaccine to certain providers independently from what we're doing at the state. So we receive our state allocation, which goes to our provider network, like I just mentioned. And the federal program also gives vaccine to certain partners, mostly retail pharmacy partners. So that would include Rite Aid, Topco, CVS, Walmart, Albertsons, Good Neighbor, and I think a couple others. So the federal government sends vaccine directly to those retail pharmacy partners, and we're looking at about 500 to 600 of them across the Commonwealth here. They also directly support, the federal government does, they push vaccine directly to some federally qualified health centers across the state. We particularly love that program. Federally qualified health centers serve a really important slice of the population who might otherwise be underserved. In addition to that, FEMA has some federally supported sites, most notably the one in Philly, which is separate from our program, but just another way that the federal government is supporting the Commonwealth overall. I also should mention our long-term care vaccination strategy. Pennsylvania did participate in the federal pharmacy program in long-term care, where CVS and Walgreens went to certain long-term care facilities, including skilled nursing facilities, which we regulate at the Department of Health, to go into facilities, meet folks where they are, and vaccinate them on site. That program did end. They visited and did 3 clinics at each facility that was a part of the program. And the department is continuing to work with the federal government and group purchasing organizations that pharmacies are already a part of to continue to supply vaccine to long-term care facilities and to the staff, since we know that's not a stagnant setting. So there's always new residents and new staff coming in and out. The department has also worked on a couple special initiatives, most notably teachers. We vaccinated over 100,000 teachers using the Johnson & Johnson product. We had no notable cases there, nothing notable with the product, with our vaccinations, with vaccinating over 100,000 teachers. We've also worked with the Department of Agriculture and the Department of Human Services to vaccinate some of their facility-based stakeholders, as well as some hard to reach populations in the agriculture space. Just something I want to make sure that I hit on before, Kevin, if there are any questions or if I've missed anything, but I really wanted to talk about just additional important public health pieces that haven't gone away yet. We will sort of look at things through several lenses, really containment, mitigation, and then the therapeutic stage. So containment is really where we were a few months ago, and we still continue to do this work, but it involves our case investigations and contact tracing, isolation and quarantine, our mitigation efforts, which I know you all are very familiar with, masking orders, business closures, and so on. This is a really important piece for our mitigation tactics. And then we look at therapeutics, which is really the vaccine, along with other important drugs like remdesivir or monoclonal antibodies, which help when people do get sick. So, those things are still of paramount importance for us at the Department of Health. We want to continue to have people wear their masks, social distance, wash hands, all of those great public health pieces that we've been preaching since the beginning of the pandemic, that really is what's going to continue to keep us safe over the next couple months until we do reach that herd immunity stage and beyond. I'm realizing now that I've talked a little bit, Kevin, that I did not mention, what is easiest for you all and your teams to get vaccinated. Going to a site, you can go to our website. We have a map on our website with vaccine providers. And that includes several The federal pharmacy programs, I personally went to a Rite Aid in my neighborhood to get vaccinated. Our eligibility is open for all Pennsylvanians now, and we are seeing open appointments across the Commonwealth. So if you have not gotten vaccinated or haven't encouraged your staff to do so, we really recommend it. I get asked often about how employers can bring providers in to vaccinate their staff on site. The department does not have to approve partnerships like that. We encourage you to work with local pharmacies or other providers in the targeted network to see what options there are for you and your staff. I've heard of several opportunities that pharmacies or healthcare providers are able to come into a workplace and do vaccinations or help get appointments. So any of those local partnerships are really excellent ways to move forward. Did I cover everything, Kevin, Amy? Am I missing anything? Any big questions?
Yeah, I think it was good to understand that federal pharmacies and that they're all listed on your site, so that it's, I think that's not been clear to employers who to contact to come on, so that, as you said, with everybody being 16 and over, they can really reach out to anybody at this point that's listed and see if they can work something out.
Yep, we also put all of our data on open data that's linked from our website, but we have an open data portal that shows like the raw data behind the map, behind all of our vaccine information. It includes our allocations, so you can take a look at the first dose allocations that the department gives, at least from our perspective, to our providers. All of that is listed on the open data portal, and you can jump to it from our website.
Okay. I think another question that we hear a lot is, and I think you're probably observing it, is as we reach the full availability, there's still a significant number of people that are concerned about, should I get it and what could happen? And obviously the J&J caused some concern for folks. Will you be creating any content that or collateral that employers can use to, because I don't think the employers want to take on the responsibility to say it's safe or not, but will you be preparing anything that employers can use to disseminate to their employees?
Yeah, absolutely. So our team is working in partnership with the Department of Community and Economic Development to put together a vaccine piece of our PA Unites Against COVID campaign. So we're in the final stages of pulling all of that together. We have a media buy coming up with other additional information, and I should have collateral and things to share that can be co-branded with other organizations, with the department, or with PA Unites Against COVID to send out to employees or consumers. So I think we're looking at that very shortly. And we're obviously welcome to hear any feedback, or if there is any specific hesitancy concerns that you're seeing amongst your constituency, please keep me posted. I think we were expecting several different groups of people to be hesitant, but something that is standing out to us is young people, that younger people are not getting vaccinated at the same rate. To be fair, they have not been eligible quite as long, but that's something that I think we're really going to be thinking about and working towards, is making sure that younger people, particularly those who might be coming home for the summer, but are then going to go back to a congregate setting in college, make sure those people are getting vaccinated over the next several weeks.
Okay. And, I'm the eternal optimist. So looking ahead to when we reach herd immunity, have you began to discuss modification? Professional leagues are saying about people that are vaccinated, or 85%. Any thoughts yet about what that will look like?
What it will look like, I'm not sure, but we're definitely thinking about it, talking about it. We did just adjust the mitigation order, I don't know, maybe 2 weeks ago. Right. That included a change to the remote work requirement. It was, you must work remotely unless impossible. Now working from home is strongly encouraged. I'm still at home, so we obviously really continue to encourage that. The CDC is something we look at really closely to align our guidance with. So I think as you're starting to see things change at the federal level, we will begin to make adjustments with our guidance as well. And for a good example of that is the CDC changed their travel guidance, and then we followed. So I think the more you see changes coming from the CDC, we will likely follow them.
Let me just take a look. So we did have a question was, is there any updates on the vaccine's effectiveness against the variants? And then, yeah, any word yet, and well, kind of where things are with respect to annual boosters at this point?
Yeah, so boosters, at this time, we don't have any official information from the CDC. We're really going to monitor that information. And I think we're learning about that at the same rate as everyone else on what's going to be needed next. So that's kind of a stay tuned. We're waiting to see what happens with boosters. In terms of the variants, our team's keeping a really close eye on that. That's something our epidemiology team is absolutely concerned about. I'm trying to look, I have some notes on this because I want to make sure I get it right. So we're looking at variants, but also at breakthrough cases. So breakthrough cases are for someone who has been vaccinated, but then still becomes sick with COVID. So in terms of the variants, there's been a pretty big increase over the past couple of days. The CDC website shows that 850 variants are in PA. That includes UK, South African, and Brazilian. I know our team has tried to stop using the country, knowing how damaging it can be if it were to become widespread, but in terms of calling out a specific country, but yes, we are seeing cases of a variant. Pennsylvania does have a pretty high, we're the 7th highest in the country in terms of our variant cases. But it's really hard for us to tell. That's something that we're struggling with at a national level is the genomic testing that needs to happen in order to tell if a specific specimen is a variant case is not something that every lab can do. So that's been a struggle across the country in order to pivot to test for these specific variant types at different labs. We're not alone in that struggle. Breakthrough cases, that's something else that we've been keeping an eye on. So far, we've reported about 300 cases to the CDC involving individuals who've tested positive more than 2 weeks after receiving all recommended doses of their vaccine. In a lot of ways, breakthrough cases are normal. We know that as more people are vaccinated, the less and less chance we'll start to see this, but it is something that we're really making sure to monitor given the variants and the number of cases that we're still seeing every day. So again, that's kind of more to come on that. I know our team's taking a close look. And if you'd like specific clinical answers, I'm happy to run them down for you.
Just on that one, do you know whether of those 300 are most of them either asymptomatic or low?
I don't know.
Okay.
Yeah, I don't know.
Okay, a question was asked, does the current antibody COVID test detect which variant? I guess when you were saying how you're detecting it, is there a particular test people should get if they want to know what variant they have?
So the way it works is when you're not, you're feeling unwell, you get a PCR test. We're able to test for the variant. But doing that genomic testing is a heavy lift and not every lab can do it. So it's possible that you would get a positive COVID test, but not know which variant, just given our lab limitations. That's something that labs are rapidly trying to pivot to test for each variant, knowing that we're continuing to see more. So every time a new variant pops up, we have to develop the ability to test for that too.
The travel policies. Someone asked the question, and Amy, this may be for you, but with summer coming up, should companies be asking where an employee is traveling and what they're doing, or and I'm not sure I know exactly how the CDC. I know they said there's not as the quarantine's not required in country, but any thoughts about what recommendations companies should do this summer with everybody wanting to go travel again?
Yeah, I think from our public health perspective, still traveling and being around others is not recommended, although we know that wearing a mask, getting vaccinated can keep you safe. So we recommend that you relay that information to all of your employees. Right now, from our perspective, there isn't, say, a specific state that you should or shouldn't travel to in the same way that there was several months ago. And I really defer to Amy and the HR expertise on what and how you can ask, your employees on where and what they're doing. But all the public health, hand washing, mask wearing, social distancing things all still apply, even when traveling after being vaccinated or before.
Okay. I think that's it. Megan, that's been great. We would love to get the material that we can disseminate to our members once you guys have anything to help them. Because I think the next challenge will be to really convince, suggest to employees strongly that they all get vaccinated, because we know that's going to help everybody. But thank you so much, and congratulations on the success the Commonwealth has had. Being 5th is great, but we'll love to keep having you in every couple of months, because as you said, it's not just it's that they're in mitigation, containment, therapeutic. I think that's a forever process we're going to be going through. So love to hear from you.
Yeah, I'm happy to come back. We talked earlier, I didn't make any slides because things changed so quickly. So this is the current state, but I think we do expect an announcement from the CDC and ACIP on Friday or early next week about Johnson & Johnson. As we know, that single dose is a real game changer for us.
Yeah.
Multiple factors, hard to get someone to come back for a second, afraid of needles, any number of things. A single shot is a really big deal. So we're hopeful we'll be able to use that product for at least a slice of the population.
And have you been able to accumulate doses with that, or how did that work with the distribution over the last couple of years?
So the federal government identified that we would receive, a couple weeks ago now, we received over 100,000 doses of Johnson & Johnson. Then we received about 66,000 doses, then 20,000. And then this week we were supposed to receive 6,000, just 6,000. But since everything has been paused, it's a little bit difficult to tell. So we do have the ability to order against the state's allotment. And we have really great plans in place to reach folks, those who are homeless, those who work in migrant settings, those who are harder to reach populations and might not come back for a second shot. So there's a lot of plans that are sitting on ice waiting to see if there are further restrictions. Our new physician general, Dr. Denise Johnson, I've heard her say that this pause really should give people more confidence that the vaccine is safe. It's had even more scrutiny. I know that will be something for us to overcome, but it has had even more scrutiny on it, and it truly is 1 in a million. So 6 people out of almost 6 million doses administered. And the pause has also given physicians the ability to learn about what side effects might be and how they can diagnose them safely and appropriately. So we think that's something that's really important going forward, is education for physicians, in addition to the safety of the vaccine, but knowing that physicians will know what to look for is super important.
Yep. Awesome. Well, thank you again. This has been great. Have a great day.
Great. Thank you.
All righty.